Hello, I'm Donna Sunday. In this video, we'll explore fundamental massage techniques used by professional massage therapists. When we teach these techniques in a classroom setting, we split them into 3 routines.
We start with a closed compression routine to get students acquainted with the body. This is a great routine to loosen tight muscles, and it's something that we do when practicing on athletes at sporting events. Then we move on to a relaxation sequence, which is a non-specific massage that is soothing and restorative. For the therapist, this sequence is about learning to be present, rhythmic, and slow with the techniques. Finally, we show a more specific sequence that includes muscular work. Once you learn all 3 sequences, you should combine the techniques and tailor each massage to the person that you're working on. Being creative in this way will make the massage more enjoyable for you and your client. The techniques shown in this video are safe, but there are some contraindications to massage that you should be aware of. You shouldn't perform massage on bruises or cuts or on areas where there is edema, varicose veins, or inflammation, an area that is hot, red, and sensitive. You should also be careful working on people with phlebitis for fear of releasing a blood clot. Also be cautious with people who have high blood pressure because massage will slightly raise the blood pressure during the session, and then the blood pressure will decrease after the session. Finally, don't perform massage on people with the flu or with a bad cold. These are a few of the contraindications for massage, and you may want to study further before you begin working on the public.
If people are under the active care of a medical doctor for any reason, you may want to get the doctor's consent before you perform massage. Be aware of the contraindications, but realize that mostly massage is safe and healing. Before we start, here are some tips to staying healthy and using your body mechanics correctly. First, make sure the table is set to the correct height.
To set the table, make a fist with your arms at your side. The table should be below your fist. The table should be lower for your larger clients and also if you want to apply deep pressure. The table can be higher if you are performing a light pressure relaxation massage. When you are applying pressure, take a wide stance, knees slightly bent, and move from the hips when you apply pressure. As much as possible during the massage, make sure the joints are in alignment. Try not to bend your wrists too much and use your body weight to apply pressure rather than your arm muscles. When using your thumbs, you can support them on your index finger. Finally, make sure your body is relaxed while performing massage. This means your shoulders are dropped, your jaw is relaxed, and eyes are soft. If you are straining, you are doing it wrong. Massage should be easy and relaxing for the giver and the receiver.
If you have a hard time relaxing yourself, you may want to practice yoga,
meditation, or qigong to get into a relaxing space
so that you can transmit this to your clients. Let's get started.
Compression sequence. The compression massage sequence is a great way to start learning massage.
You don't have to deal with draping. It's easy to do and can be done anywhere. Start with your client wearing loose clothing, face down. We will start the session with technique number 1, holding. Stand at the side of the table, one hand resting on the upper back, the other on the sacrum. Quiet down inside. Become aware of your client's breath. This is a good time to offer a silent prayer or meditation if that appeals to you. You can also verbally guide your client into being aware of their breath. Intention for this technique is to activate the parasympathetic nervous system, dropping the person into a deep state of relaxation. This is also a beginning and an end hold, a way to frame the session with stillness. This is a time of deepening, so refrain from extraneous conversation. Technique 2, trapezius compression. Stand at the head of the table and use your palms to apply pressure into the trapezius, alternating from side to side.
You can also use your forearms for this technique.
Technique number 3, back compression. To perform back compression, apply rhythmic compression on the opposite side of the spine using the palm of your hand. Use your body weight to lean on rather than using muscular effort. This means that the table needs to be low enough for you to get over your client. Make sure the pressure is rhythmic and slow. You can also include a gentle rocking with this technique. The intention of this technique is to soften the erector muscles on both sides of the spine, increasing blood flow and gently stretching the muscles by the rhythmic compression. This is your initial contact, and it is an opportunity for you to scan the muscles and get a sense of any tension. It also helps the client to relax and get comfortable with you before you start the more detailed work. Make sure not to apply deep pressure to the spinous processes of the vertebrae. If your wrist hurts during this technique, decrease